Welcome back to BioScope. Today, we are diving into a serious public health issue, the rising of brain eating amoeba cases in Kerala. What is happening, why it's so dangerous, and what you can do to stay safe. Stay tuned with me. Did you know that so far in 2025, Kerala has seen nearly 70 cases of rare brain infection caused by an amoeba, of which about 19 people have died. In this video, we will break down what causes it, how it spreads, and how can you protect yourself. So the first thing we need to know is what is a brain-eating amoeba. The scientific name is Naegleria Fowleri. It is a free-living amoeba found in warm, freshwater lakes, rivers, and hot springs. It is not contagious person to person, does not spread by drinking water, rather enters through the nose. The main disease it causes is primary amebic meningoencephalitis or PAM. It is a very rare but extremely severe infection condition. It has high fatality rate, often nearly 95% or more, because when the symptoms appear it's already in its advanced stage. Now the main thing is how it works. It enters via nasal cavity, travels up to the olfactory nerve, crosses the cibriform plate, and then reaches the brain, causes inflammation, swelling, and destruction of brain tissues. What are the symptoms? In early stage, you can feel headache, fever, nausea, vomiting, but as the disease progresses, you can feel stiff neck, confusion, hallucination, seizures, often coma. Onset from exposure to the symptoms can be 1 to 9 days, sometimes hours to couple of days for severe diseases. So what's happening in Kerala right now? In 2024, near about 36 cases were filed and 9 people were died. But now in 2025, we have already witnessed 69 cases and almost 19 deaths. Unlike previous years, this year the cases aren't clustered in one local area. They are appearing as isolated or sporadic cases across the state. It can affect infants from 3 months old to elderly persons. For example, we can say a 9-year-old girl in Kozhikode died after rapid deterioration. A 17-year-old boy contracted in after using a swimming pool, and that pool was shut for testing. The government or the public health responses are chlorination of the wells, water tanks, public bathing areas, and increased surveillance, public warnings, and encouraging early diagnostics. Now, why this diseases is increasing? The first thing is the environmental factor. That is, the warmer water temperature favors the brain-eating amoeba to grow. The amoeba thrives in warm water or warm fresh water, especially when it is stagnant. The climate change and rising ambient temperature leads to more water body warming, which further leads to more favorable condition for this type of diseases. Some human behaviors are also involved. For example, increased use of freshwater bodies for recreation, like swimming or bathing, especially during hot weather, and lack of awareness about risks, especially that risk is via nose, not via drinking. And if we talk about the infrastructure or prevention gaps, some water sources like wells, tanks, public bathing areas are not properly treated or chlorinated, and further delays in diagnosis because it's rare. Initially, symptoms are mimic more common like bacterial meningitis, and it is misdiagnosed. Late presentation makes treatment very challenging. Now, if we talk about the treatment, there is no guaranteed cure. Treatment involves an antimicrobial or antifungal cocktail that needs to reach the central nervous system. Examples include amphotericin B or miltefosine, etc., though not that much effective. Early detection is essential. The earlier the disease stage, for huge brain swelling or cerebral edema, the better the chance. The survival rate globally is extremely rare. Rates often cited as less than 5%. Some reports say it is almost 3%. Kerala claims somehow better detection and outcome if diagnosed early. The government has spoken of improved testing and diagnostics. But the main challenge is its rapid progression. By the time many people seek care, the infection is in advanced stage. Lack of specific diagnostic capacity in many locations, labs may take time to confirm. Limited awareness among medical professionals because the cases are very rare. Now, what we can do? In personal level, we can avoid swimming or bathing in warm, stagnant freshwater bodies like ponds, river, or lakes, especially in summer. If you must swim, use nose clips or hold your nose. Avoid submerging your head deeply underwater. Use only boiled, filtered, or properly chlorinated water for nasal rinsing. Do not use untreated water. Maintain swimming pools properly. Ensure adequate chlorination. For households, ensure water tanks, wells, pipes are well maintained and sanitized. In the community, we have to regularize the testing of public water resources and bathing areas. Public health messaging is very important, mainly awareness campaigns about the PAM spreads and how to detect early symptoms. We need to upgrade the infrastructure, ensure water supply systems are safe, eliminate stagnant water bodies and manage them. Now, what we can do if symptoms arise? We need to take medical attention immediately if after exposure, like recent swimming or bathing. And we have to ask doctors specific about the PAM or free living amoeba if the initial meningitis tests are negative. Now, we can say that as temperature rise globally, more water bodies may reach the ideal condition for this type of infections to proliferate. This could lead to more outbreaks. The outbreak underlies the need for better diagnostics capabilities, more labs, faster treatment protocols, and more awareness among both public and healthcare providers. Kerala's recent efforts by chlorination or surveillance are kept steps forward but may need to be scaled. PAM has been recorded in many countries like US, Australia, India, Pakistan. It's extremely rare, but when outbreaks happen, they are deadly. Kerala is one of the several places with this type of diseases and is concerned due to warm freshwater bodies. So, to sum up, Naegleria Fowleri causes a rare but almost always fatal brain infection. Kerala is seeing many more cases this year, likely due to environmental warming and increased exposure. Early detection and prevention are our best defense. So, what we can do? We can aware of water safety, share this information so more people know how the disease spreads, and push the safe infrastructure in our local areas. So if you found this video helpful, please like, share and subscribe to BioScope. Have question or heard of cases in your own area? Drop a comment below. Let's keep the conversation going. Stay safe and see you in the next episode.